So medications for ADHD. Ritalin's by far and away the most commonly used type of medicine. And there are various forms of that. So there's a short-acting form of Ritalin, and then there's a long-acting form which lasts for 6 to 8 hours. We used to have access to another form of Ritalin called SR, but now there's a generic called Rubifin. So there's Rubifin, SR, and there's also immediate release Rubifin. And within the methylphenidate, so they're all methylphenidate preparations. And there are a couple of other ones. There's Concerta, which has an even longer duration of action, usually 10 or so hours. And I often feel that that's best for teenagers who need longer duration, or adults who have ADHD. And Pharmac have introduced a generic called Tiva ER, which is supposed to be relatively close to Concerta, but a seventh the cost. So there's quite a range of methylphenidates, and there are short-acting forms and intermediate-acting forms and long-acting forms.
And why would you choose short-acting initially?
So I tend to use short-acting initially with much younger kids, where you don't want the medicine in the system for too long, and you can use much smaller doses. So you can use 5 milligrams or even less than that, whereas the long-acting preparations, the minimum dose is 10 milligrams for Ritalin long-acting, or Concerta is 18, or Tiva 18. So it just allows you to use lower doses in people that might be vulnerable, or where there's concerns about other things that you want to titrate more slowly. But in adolescence, I usually prefer to start with a longer-acting medicine, and so Tiva's been quite useful for that, because we can still use the same special authority that we do when we apply for the short-acting forms of methylphenidate. So I think that's going to be a helpful medicine, although more recently it was a supply issue. So the methylphenidates, they have about a 70% chance of being moderately helpful or better for ADHD. But they don't suit everybody, and there are 2 other forms of ADHD medicines that are available in New Zealand. There's dexamphetamine, which is another stimulant. So it's like Ritalin, methylphenidate, but different. I call it like a cousin. Similar, but and for some people they have a better response to that. So about a third of people might have a better response to dexamphetamine, and about a quarter of people would have a better response to methylphenidate. Methylphenidate tends to be a bit better tolerated. So if people haven't responded to methylphenidate, they possibly should have a trial of dexamphetamine to see if that is better for them. And there's another medicine called atomoxetine, which isn't a stimulant, and it was developed as an antidepressant. So it has a 24-hour action, takes a while to build up in the system, and takes a while to start working. And it tends to be a little better tolerated than the stimulant preparations overall, but sometimes it causes much the same side effects, but can cause sedation at times, and there's some rare difficulties with atomoxetine. It can lead to a hypomanic or manic episode in people that are vulnerable to that, and you have to watch for increase in suicidal thoughts, and there's a very rare chance it can affect your liver quite badly. So it's kind of third line. It would be the number 3 treatment generally. It's also tic neutral, so if kids have bad Tourette's and they get worse on stimulants, then atomoxetine would be a good trial medicine for them. And in the States, there are 2 other medicines which have the tic for ADHD. So there's a medicine called clonidine, extended release, and that started out life as anti-high blood pressure medicine, and it has quite good evidence for being helpful for people that don't do well with stimulants, or sometimes who don't do well enough and you add it to a stimulant. But New Zealand hasn't funded clonidine XR. We have a short-acting form, so we can use that off-label, and it's not used that much, but is used a bit. And then there's another medicine in the States called guanfacine, extended release, which again is helpful, and it would be good for us to have that. and it's under consideration at the moment by Pharmac. They're looking at that, but haven't made a decision on it yet. So there's sort of 5 options really for ADHD. There's one other medicine that's under consideration by Pharmac called lisdexamfetamine. So it's a long-acting form of dexamphetamine, and has the big advantage of being very difficult to abuse. So dexamphetamine's got some street value and can be diverted, and lisdexamfetamine gets around a lot of those issues, and we're hopeful they may fund that next year.
I'm fascinated because I know that, for example, Australia's got different stuff.
Yeah, they've got Lisdex and they've got guanfacine XR,
Yeah.
so they've got better tools than us.
So if this is just an if a person in New Zealand wanted to trial one of those and they're not funded in New Zealand, can they be prescribed it by you and import it themselves, or?
Yeah, I've prescribed lisdexamfetamine a couple of times, and it's been very helpful for one person who had done poorly on other ADHD treatments. And I have used guanfacine a little, so 3 or 4 times, and people can pay for it. But lisdexamfetamine is about $100 a month, and extended release guanfacines depends on the preparation, but again around about $100 a month.
So it's not that these medications are unavailable in New Zealand, it's that they aren't funded by Pharmac and that there is a cost involved.
Yeah, and often too much for families, although some families can afford that, and